Very interesting program. But for those who missed our show a year ago, why don't you provide us a brief history of your background, the company's background, and some of the work that you're doing?
So I have a company and we're working on Alzheimer's and Parkinson's disease. And I've been working on this approach for 16 years, and finally we are close to marketing. And so I'm very happy to be here again to tell Dan how much progress we have made in the last year. We have a novel approach to Alzheimer's and Parkinson's disease. We actually make the brain work better. And it's easy to explain if you think about what's going wrong in Alzheimer's and in Parkinson's. In Parkinson's, people slur their speech, they shuffle their feet. That's because the information from the brain to the tongue to the feet is slow. It is inconsistent and it is slow. In Alzheimer's, people forget, they get lost. That's because the information from the right hemisphere to the left hemisphere is slow. What our drug does, it speeds it up. So by having the normal speed of information transfer, patients become better. And that is really why our drug works in Alzheimer's and in Parkinson's. And we have really good data in 1,200 patients that we see excellent improvement in cognition in Alzheimer's and in movement in Parkinson's. So as I said, I'm here to give Dan and you an update, because last year we had not started the pivotal study yet, and now we are in the final study before marketing.
Well, that's great news. I mean, we obviously know. I mean, I can't tell you how many lives are touched by Alzheimer's and Parkinson's, and to hear you guys are close to breakthroughs, that's really encouraging news. Why have there been so many failures with the Alzheimer's drugs?
Well, number one, mostly pharma, started out by saying that there is one toxic protein in the brain. Most people have heard that there is plaque. That is correct. There is one toxic protein. There is a second one. Some people have heard there are tangles. Most people have not heard that they're Lewy bodies. Lewy bodies are usually associated with Parkinson's disease. Well, they're also in Alzheimer's. And then we have other inclusions. So what happens in an Alzheimer brain is that there are maybe 4 or 5 toxic proteins, and we only knew of one. So if you just remove one when there are 4 or 5, you obviously are not very lucky and you don't get very good results. The other one is that the companies that did not go after plaque, which is A beta and is the first toxic protein to be described, they went other different ways, just like us. But different ways, you don't have as much information. So you're digging in the dark. And unfortunately, a number of these approaches have failed. So I'm very thankful that we are still here and our approach looks like it's really working.
Maria, if I may, well, clinical trials, where do you stand with them, and how are the results showing?
So as I was briefly mentioning, in clinical trials, phase 1, you just do safety, mostly in healthy volunteers. Phase 2, you do small studies. Phase 3, you do huge studies. So right now we are doing a 760, 18-month study to show that our drug does not just work short-term, which we showed before, but also long-term, in that it does not work in a few patients, but in 760 patients. In total, this is for Alzheimer's. In total, we have also treated Parkinson's patients. And we are starting a Parkinson's study, a large 700-patient Parkinson's study in January. So by next year, we will be in one large Alzheimer and one large Parkinson's, which are the last studies we need to do to show that the drug works in a large population and works long-term, which is 18 months.
So Maria, go ahead.
Go ahead, Dan. I was just going to have a follow-up. How do you identify efficacy with a population that's probably unhealthy in large ways in your phase 3 trials?
That's a very good question, because you're 100% correct. Alzheimer patients are old. They have a lot of comorbidities, and they could even be depressed. So we are trying the best to have a somewhat homogeneous population, but that's impossible. What we are doing really is compensating by a lot of people, so it averages out. That's why we need these large studies. In cancer, you could do it with 20 patients. If they die or don't die, that's pretty binary. In Alzheimer's, we need 700 to 1,000 patients to show that you can even out the differences between a good day and a bad day and between the different comorbidities.
Yeah, quick question, Maria. So I know this is a long process, and I think it would help. Like I said, we talked a year ago. Tell me from a general perspective, time frame from the time you guys begin to develop a drug. I mean, I know it's a long time, and then you have to go through the trials and all that. What is the normal time frame to bring a drug to market, and where are you guys at in that time frame?
It's 10 to 20 years, and we are at 16 years, so we're getting there.
That is crazy. That is crazy.
Most drugs don't make it. They fall through. So the fact that we are 2 years from market really means we have done great.
Yeah, that's phenomenal.
So
what milestones do you expect to achieve in the next 12 months?
So the first milestone will be end of next year. We will have treated the 760 patients for 6 months, and we do an interim analysis. And then the second milestone will be end of 27. We will have treated the 760 patients for 18 months. So the difference between 6 and 18 months, does it work short term? Does it work long term? Realistically, you cannot treat patients for 10 years. So the FDA is okay with 18 months.
I'm just going to shift gears on you. How are you financing the company? How are you financing all this clinical work?
Well, there are two ways. One is I pray, doesn't work. And the other one is we have become a public company, because I was not able to raise enough money to do these studies. The 760 patient studies is $70 to $80 million study. So you do 2 of those, that's 150 million. And I told you that we have treated to date 1,200 people. So before we even started the study, 150 million went into the company. So we went public. I'm on the market. I raised capital. So I don't think you want to give me your client stuff. You should. It fits retirement beautifully.
So that's the question, Maria. So what is the value proposition? If I'm talking to a client and I say, hey, we've got this company and they're doing some great work in the Alzheimer's and the Parkinson's field. What's the value proposition for somebody that's considering buying your stock?
So I'm biased, okay? But remember, I've been biased for 16 years, and every year I make it, my bias becomes smaller and reality becomes bigger, okay? Because you're still here, you're still kicking, you're still doing fine. And my opinion is that we are totally undervalued. Our market cap is maybe 120 million. My goal is to sell the company to pharma for 20 billion with a B. And the reason is the market is 150 billion with a B.
How do you, the value to a pharma is going to be reliability and broadness of the therapy. Your breadth of therapy is huge.
Yes.
So the question is what's the incremental efficacy that you're seeking, and how are you doing?
Okay, so number one, we are conservative. You wouldn't think me being conservative, but when it comes to the FDA, I'm ridiculously conservative. I do exactly what the FDA says. So we use exactly their endpoints. If the FDA says use ADAS-Cog13, I'm using ADAS-Cog13. So the pharma has to accept that because that's what the FDA accepts, and that's what gets me on the market. So that's from an endpoint point of view. So in Alzheimer's, we use cognition endpoints. In Parkinson's, we also use what the FDA says, but you use movement endpoints. In terms of what is important is actually to really get a drug on the market that has efficacy. Now, we do have 2 drugs on the market that have efficacy. And let me explain how that works. If one is called Kisunla, it's Eli Lilly's, and the other is Leqembi, it's Eisai Biogen. They say that the drug improves cognition by 30%. It does, but not really. If cognition goes downhill by 100%, this is untreated patients, the drug does this, okay? It goes downhill by 70%. So it improves cognition over 100% by 30%. What our drug does, it does this. Now, pharma can say it's short-term. Right now, I only have short-term data. It may flop after 6 months. It may just go bust and it has no efficacy. I can't prove that. That's why I'm doing an 18-month study. But right now, our drug looks about 500-fold better than pharma.
That's awesome.
Yes,
yeah, that's great. That is great. And the process, I mean, I give you a lot of credit. I mean, to be working on something for that length of time, not really knowing if it's going to pan out. I mean, I give you all the credit in the world, but what do you see moving forward, Maria, as your biggest challenges in the next 12 to 24 months?
Well, actually, my biggest challenge is herding cats and finding enough money to herd them well. Why am I saying this? A clinical study is a ridiculously complicated, multifactorial, intricate animal. It has so many pieces, and every piece is up in the air, and nothing really fits at the same time. And in order for you to treat a patient adequately, I'm not saying that you want a good result. Maybe the result is negative, but you have to treat the patient adequately so you get a reliable result. In order for you to do that, you have to keep 100 pieces up in the air. You have to make them not fall on the ground. You have to know what is where, when, how come. And honestly, to do that well is almost a miracle. And we are a small team. We really work our butts off. We do a fantastic job, but it is still herding cats.
You've been at this a long time.
Yes, 16 years.
What was the life event, or what caused you? I mean, my father was stricken with Parkinson's and died from complications. What personal event or what trigger did you experience that caused you to go on this quest?
Well, my mom also died of Alzheimer's, but that was not what triggered me. I was already working on it. No, when I was 23 years old, this goes a little back, I learned that normal cells, like your skin cells, your gut cells, they regenerate. And that brain cells don't. So once they die, they die. And when I was 23 years old, I said, I want to keep them alive. It only took me 100 years, but I'm getting there. So it kind of.
Well, I'm glad you had plenty of brain cells for the task.
Yes, exactly.
I'm glad you have plenty of brain cells for the task.
Sorry, but my drug keeps nerve cells alive, so it works.
Yeah, that's good to hear, because I know I've killed a lot of brain cells in my day. But you know, for 16 years, you've poured your life into this. You have any regrets, Maria?
No, I mean, you know, it just took me a long time. I wish I would have known it at 23, but at 23, the science wasn't there. It wasn't even me. The science wasn't there. And I wouldn't have known how to do it. And even realistically, I started the company in 92 to protect nerve cells from dying. It failed. Now, we made money because I sold this a genomics company, but not because it protected nerve cells from dying. And then this company, okay, this company now is protecting nerve cells from dying. It just took time. I have no regrets.
That's great. So moving forward, I guess, looking at the next couple years, so you go through these clinical trials and these things, and say you get really good results, what's the next step after that?
I guess I just told you I want to sell the company, but sometimes sometimes I think, you know, I've made it so far. Why not go on the market myself and become a fully integrated pharmaceutical company? I'm thinking about it. Well, if it doesn't succeed, it doesn't matter. What was very important to me is protecting nerve cells from dying. That works. The rest, it's play. We can work with it.
Yeah.
And Maria, I thought you were going to say the goal was to keep your brain cells.
Well, I hope so. You know, even the best drug is only so good. And in fact, that's a good question because I'm working on combinations. We are working on combinations because even the best drug is not 100%. So a combination may be 100%, yes.
It's interesting. My mother, who is 88 years old, you know, she says her brain is like an old computer. It still works. It just takes a long time to
Yes.
boot up.
Well, she's right
You know?
about that. She is right. It gets slower. Remember what I told you about the speed by which nerves function? Yes.
Yeah. So that's interesting. I really applaud you for the work you're doing. I think it's, I think if it were, I mean, there's so many people it's going to help, and that's life changing for a lot of folks. Well, we're about out of time today. So Maria, I want to thank you. It was very interesting listening to you and what your company's doing. Again,